welcome Dr. Monica Parker.
Good afternoon, everybody, and thank you for joining us for Brain Talk Live. I'm really excited to have with us Dr. Zanthia Wiley, from our Department of Infectious Disease. If you remember, she was with us last year and she talked a lot about COVID, vaccinations, and things that were important for us to be aware of as we think about COVID and vaccine trials. So Dr. Wiley is going to talk to us about everything we need to know about COVID, influenza, and RSV. So right immediately after John does his exercise, we're going to be talking to Dr. Zanthia Wiley about this very, very important topic. Now, I went and got my COVID and my flu shot Saturday. I think you should get them separately, but in any event, I want to urge all of you to get all the immunizations that you are required to get at your particular age. Anyway, you can talk to John now, and as soon as he finishes, we're going to be dealing with hear from Dr. Zanthia Wiley, our infectious disease colleague, who's going to talk to us about what's important about these vaccines and why we need to take them.
All right, let me know if you can see it full screen there, everyone.
Yes.
All right, okay, we're ready to go.
Awesome. So first of all, thank you all so much for inviting me back. Dr. Parker, thank you for the invitation again. As you can see here, I am a vaccine champion. I'm really, really dedicated to ensuring that we are all as healthy as can be. So that involves exercise, that seems like we're all about to do, as well as preventive care. So I'm talking about RSV, COVID, and flu because it is respiratory virus season, and there are some things that I may tell you that you already know, and some things that you may not know just yet. Okay, next slide, please. Okay, so let's start off by talking about RSV. So a lot of people have been telling me, I've never heard about this. Where is it coming from? So RSV has been around for forever. Okay, so what it is, it's a very common respiratory virus that can cause symptoms as mild as a common cold. And it can make some people who are immunocompromised really sick where they end up in the hospital. And I really like this picture because the people who are most affected by RSV are what we call extremes of age, either the very young or are, amazing geriatric population. So it's typically kind of affecting people bimodally. And when you have these sweet babies, sweet kids, this is what you want to do. Spend time with them. They're in your faces, which is an amazing thing. However, in people who are older and in people who have immunocompromised conditions, you can have really serious illness and require hospitalization. Almost all of us, probably all of us, have had infection with RSV before, and you just didn't know. So these vaccines have become available in the US recently. So you haven't heard much about RSV because the availability of these vaccines and the updated recommendations, these are new. Okay, next slide, please. Okay, so what types of symptoms can you anticipate? Literally as mild as runny nose, maybe some coughing, sneezing, all the way up to wheezing and shortness of breath, where people can get sick enough to end up in the hospital. If you can just hit next. So the recommendations is, RSV in older adults and those with chronic medical conditions, it can be really dangerous. And so this is why the updated recommendations for the RSV vaccines have come out. It's really important for me to tell you that this is a conversation that you will have with your primary care physician, your internal medicine doctor, etc., because it is not routinely recommended for everyone. However, you will need to be 60 years or older, and we're going to go through some of the recommendations with respects to who should get it. Next, please. Okay, so with respects to RSV, so I'm an adult infectious diseases physician. So who can it protect? Again, those who are over 60, and we always also think about protection in babies. So let's just take a look up top. Adults 60 years or older, we have the vaccine. Is it for everyone? It is not for everyone. So you would have a conversation with your physician. Let's go to the next slide. However, who can most likely benefit from this vaccination? And this is what I hope all of you will do. Even if you don't qualify, I want you to think about your grandmother, your aunt, your sister, your neighbor, so you can think about, should I talk to my loved ones and have them speak to their primary care doctors about this? Next. So here are some of the things. These are the people who will most likely benefit from RSV vaccinations. So what I like to think about is chronic medical conditions, lung disease, someone with COPD or asthma, heart disease, kidney disease, liver disease, hematologic disorders, someone with sickle cell or blood cancer. And just think about the number of people you know with diabetes, whether it's well-controlled diabetes or not well-controlled diabetes, those who are frail, those of advanced age, if they're living in a nursing facility or long-term care facility, or any other underlying medical problem. So if you just think about this, a lot of our colleagues, our patients, our loved ones would benefit. So let me give you an example of someone who probably would not benefit from an RSV vaccination. Let's say I have a 68-year-old patient who is she has high blood pressure. She's had a little bit of plantar fasciitis. She is very active. She's currently training for a marathon right now. She has not been in the hospital recently. I would not recommend the RSV vaccination for her. However, my mother is almost 70 years old. She has had a lot of chronic medical conditions over the past 3 years. She is, frail, has not been eating as well as I would like her to eat. So have I recommended the RSV vaccination for my mother? Absolutely. So, what you should recommend, and if this, is talking to your healthcare provider about it. So I see somewhere in the chat that someone asked, "Hey, does your insurance cover this?" The answer is, yes. I will tell you this. So I recommended an RSV vaccine for one of my patients who went to a local pharmacy, and I got a call from the pharmacy saying, "Hey, we will need an order from you." So it's been pretty early in the rollout of this. So I don't think it was going to be as simple as, like, for your flu shot, your COVID booster, you go to your drugstore, you say, "Hey, I want this." People don't ask a ton of questions, and then they give it to you. But if you meet any of these criteria, this is a conversation to have with your primary care provider. Also, something to note is, since we're kind of early in this process of RSV vaccinations, your primary care doctor may not have the vaccine in their clinic. Okay, so these are questions to think about. In the interim, very good questions from GD Jackson. Does it um, completely prevent? This is the thing that I want you all to know about vaccines. Nothing is 100%. Okay. So I, just like Dr. Parker, went and got both my COVID and my flu shot last Monday. I got them on the same day, even in the same arm. That may not work for everyone. I'm fully aware. Can I still get COVID? Yes. Okay. Is there a decreased likelihood? Yes, there's a decreased likelihood. And I'm going to show you an image too that I think is really helpful. It shows you that a lot of these, vaccine preventable illness, it takes it from what we call wild to mild, where you may have been extremely sick if you did not get the vaccine, to maybe milder symptoms. So again, nothing in medicine is 100%. Okay, next please. So talk to your healthcare provider. Can't talk about respiratory virus seasons without talking about COVID. It is, and likely is, going to be a seasonal respiratory virus for us moving forward. So the way that we think about, the flu every winter season, I anticipate we're going to have these continued same conversations about COVID. Are we where we were a year ago, 2 years ago? Absolutely not. Is COVID gone? No, it is not gone. Do we still see deaths from COVID? Yes. So, I hear a lot of times from people like, "Hey, I don't think I want to get it because it's just not really a big deal." it may not be a big deal if you are healthy and you're around only healthy people and only around healthy children. However, for many of us who are taking care of a very vulnerable population, let's kind of, you have to think about this. And I always circle the total deaths here is, yes, this is a number, okay? However, these are people's loved ones and family members and those who you go to church with, et cetera. We're still talking about human lives here. So we can show graphs and tables all day long. But the reason that I got my booster is because I take care of a vulnerable population. My mother is frail and she visits me a good bit. My grandmother is frail, and it can be really, really tough. It is a personal decision. Next slide, please. However, what is recommended, okay? What is recommended is that everyone aged 6 months or older should get the updated COVID-19 vaccine. Okay. Are there caveats to this? Absolutely. The conversation that I would have with my patient who is, 75 years old, continuing, they smoke cigarettes with COPD and diabetes is going to be a different conversation that I would have with my 20-year-old patient in my clinic with high blood pressure. Okay. So the first patient that I brought up to you, if said person was to contract COVID, they are more likely to have bad outcomes, more likely to get sicker, more likely to have a hospitalization, and to be honest with you, are more likely to have death. Okay. So I know when you see these recommendations, just like everyone, like, really, do you mean everyone? In general, this is the recommendation, but yes, there are caveats. And the people who are at increased risk of having complications are exactly the same list that I showed you with RSV: chronic age, chronic liver disease, heart disease, et cetera, immunocompromising conditions, frailty. Okay. So I got mine. Dr. Parker got hers. It is a personal decision, but really think about the adverse effects that can happen to your loved ones and the patients that we take care of. Next. And I never give any talks without talking about health inequities and the importance of vaccination and what happens when, certain communities, including my own as a Black woman, what I have seen as a Black woman infectious diseases physician over the past 3 years is the disproportionate impact, the disproportionate death and hospitalizations in people who look like me and my mother. So if you take a look at this, just to kind of give you all an update on who has received these vaccines over the past three years, and this is of vaccines that have been administered. So this goes from December 2020 to May 2020. So remember, in May, a lot of the, kind of daily counting of the vaccines changed. So that's why we only go up through May. So I want you to kind of focus on everything in orange here. Okay. I'm specifically going to point out Black, non-Hispanic persons. And down at the left, what you're looking at is those people who have received one dose. In the middle is completed primary series. And over on the right is those who have received the bivalent booster. And what you'll see here is who's the lowest line, at least for receiving one dose or primary series. It is Black non-Hispanic persons. Believe me, I understand there are many, many, many reasons why. Okay. And it's not just vaccine hesitancy. It can be, structural inequities, lack of transportation, not being able to take off of work, being afraid to get the vaccine because if you get sick and you're, feeling achy after the vaccine, you can't get to work, et cetera. So believe me, I'm fully aware that there are many, many reasons. Historical context, lack of trust, racism, many reasons. I understand that. Believe me, I understand that. And if you take a look at the bivalent boosters, to be honest with you, all races and ethnicities are not doing great with respects to boosters. Honestly, people are not going out to get them. Many, many reasons why. What I am happy about is almost everyone has a degree of baseline immunity, whether that is vaccine induced, but so many people have had, including myself, have had COVID. So there's a mixture of natural immunity as well. So to focus on this. So when you see less vaccines in certain communities, what does that equate to? If you can go to the next slide, please. Okay. I always like to talk about life and life expectancy. Okay. So we're not just talking about, tables and numbers. So this is the change in life expectancy between 2019 and 2020 in the midst of the pandemic based on race and ethnicity. Okay. So if you look here, if you know a Black man, the change in life expectancy during that, first 2 years of COVID is a loss of 3 years of life. Okay. With respects to life expectancy, Hispanic men, 2.4 years, a Black woman, 2.3 years. So are there many reasons that, persons from disproportionately racial and ethnic minority communities are not receiving vaccines? Absolutely. But what does this equate to and who is harmed by this? Us, and us as in I'm a Black woman, okay? People in my community, people in your community. Yes, we have lost, life expectancy from every race and ethnicity, but we see the differences specifically in Black persons. Okay, next, please. Okay, so let's move on to flu. So we've talked about COVID vaccines, we've talked about the new RSV vaccines, and now let's talk about flu. And we're just going to talk about the flu recommendations, okay? And I'll just keep it short and simple for you. Who is recommended to get a flu shot every year? If you're 6 months of age or older, it is recommended for everyone. Again, I understand everyone's not going to want them, and I'm going to show you everyone does not get them. So this is looking at flu hospitalizations and vaccination by race and ethnicity. And we're looking over the last 15 years. I always like to kind of look at things, not just the last 3 years, but what has happened over the last 15 years. Okay, next, please. All right, so big picture. How many people get flu vaccines? Let's say this last season, about 50%. Okay, so most people do not get the flu vaccine. So only 1 in 2 Americans got it. Again, it's recommended for everyone over the age of 6 months. Everyone doesn't receive vaccines. When we look at those from minoritized populations, it's less than 43% in Black, Hispanic, and American Indian populations. And again, this is the 2021 to 2022. But what happens with decreased vaccinations, we see flu hospitalization rates are 80% higher among Black adults than white adults over, this 15-year period. Next slide, please. And I always like colors and visuals. So what does this mean? On the left side, so this is looking at hospitalization. Black are purple. And if you look at rates of hospitalization, who is in the hospital more from influenza? It is Black persons. I always like to point out the positive as well. If we look over here at 2021 to 2022, has it gotten better? Thank goodness, yes. And again, what we want in healthcare is equity. I'm not saying that I want, less hospitalizations for Black people than white people, but what we want is equity and for it to be as low as possible for everyone. So who receives, if you look at flu vaccination from between 21 and 22, it's lowest in Hispanic populations, and 41 and 42% respectively in American Indian and Black populations. But just big picture wise, it's about 50%. So why did I get my flu vaccine? I'm in my 40s and I'm healthy. Got my flu vaccine because I take care of people who have immune compromising conditions. Also, I got the flu when I was in college, and it was one of the sickest times I've ever been in my life. So I don't want to get sick again. Does everyone need to get a flu vaccine? No, not. Do I recommend it for everyone? Yes. Is everyone going to want to get it? No. Okay, next, please. All right. So I really like this slide. So, someone asked earlier, like, hey, will it prevent you from getting anything? No vaccine 100% prevents anything. But I like to think about vaccinations can take you from wild, where you're sick as a dog in the hospital, etc., to maybe mild. I'll rather have a runny nose and a little bit of sore throat and move about my day than be so sick where I'm lying in bed. So think about vaccines as taking you from wild to mild. Again, flu vaccines are recommended for everyone 6 months or older, with very rare exceptions. And with flu vaccines, we have a role of protecting one another. So think of all vaccines as taking you from like wild to mild. And I think that last slide is I'm so glad that you all are really focused on vaccination for sure, but also research. So we at the Hope Clinic, which is where I spend a lot of my time, I'm a researcher and a clinician. We have plenty of trials. One of the trials that we have coming up is looking at people's responses to vaccines and their bone marrow. So this little picture here is it's October, it's Halloween. That's why you see the little cookie with the skeleton. So if you are interested, if someone else may be interested, here are some of the details and information on how to contact us. So thank you all for inviting me. Remember, prevention is important. The exercise that you're about to do is wonderful, but vaccines are preventable as well. Someone put in here shingles as well. Didn't talk about shingles today because it's not a respiratory virus, but it is recommended for people over the age of 50 or with immunocompromising conditions. The great thing about the shingles vaccine, you get two, you're done for life. Thank you.
Thank you, Dr. Wiley. That was excellent. And you made it so easy for us to understand exactly what you were saying. With reference to your last slide, you talked about volunteers needed for bone marrow study. Is this to look for immunogenesis or immune
Exactly.
infection fighting cells?
Absolutely.
Okay.
Yes.
So we don't have to have any, what are, I guess, the exclusion? What would make us ineligible for this study?
Wonderful question. So when we say healthy adults 18 or older, so someone who does not have cancer, is not living with HIV, we have a really kind of long list of exclusion and inclusion criteria. Baha, whose information here, is the best person to email to give you the explicits. So this may be someone who is a very healthy 60-year-old. You may know someone who's 25 years old who may be interested. It does involve bone marrow aspiration. The procedure is done by a hematologist, and it helps us to learn more about vaccines and how they work. And I'm really passionate about is how do they work in everyone, not just in, quote unquote majority populations.
Okay, on that note, everybody, we're learning about how vaccines work in everybody. The telephone number is 470-368-1903. 470-368-1903. And there is an email. Somebody asked, what's a bone marrow aspiration? People sticking a needle in your hip bone to draw some of your red cells out. So yeah, it's not innocuous, but they're going to stick you. But you're going to make sure that we get through it, right, Dr. Wiley?
Of course. Yes.
Okay. And on that note, do you have any ongoing vaccine trials that we should know about?
No, so not at the moment. We have either, enrolled in many of them, but no new vaccine trials that are currently enrolling. Thank you so much for asking. And everyone at the Hope Clinic, let's just, you can also call and get a general idea of plenty of other different studies that we have. They're not all vaccine related.
Okay. Okay. So there are a couple of questions in the chat I want to direct you to, Dr. Wiley. Mrs. Williams had a serious case of COVID, and she wants to know what are the lingering effects because she has balance and dizziness. And she says it's not Alzheimer's, but is it something that she needs to be any of us need to be concerned of, these post-COVID syndromes? Is there research being done?
Yes, there's research being done, and there's research being done at the Hope Clinic, and I'm one of the lead researchers for the long COVID studies. Another reason, and I'm glad you brought this up, when people think about COVID, they usually think about, I'm either going to have an infection, I may go to the hospital. Some people die, but what people don't know is up to a quarter of people develop what we call long COVID. Some people call it, long haul syndrome, and it can happen to any person of any age where you can have progressive difficulty concentrating, severe fatigue, shortness of breath, etc. And what we find too is people who are older, everyone likes to say, "Oh, you're probably just aging," and that is not necessarily the case. The first place to start is with your primary care doctor to make sure that they've done kind of a full evaluation on you to make sure that there's nothing else. But yes, to answer your question, ma'am, could this be long COVID? The answer is yes.
Okay, on that note though, for long COVID, if you could just write it down or put in the chat who we should call about that particular long COVID study. We'd like to know more about that, but this long COVID syndrome, I've heard different things about it. And I think that the issue is there a treatment for it?
And that's what we're working on. That's what we're trying to figure out right now. Is there a specific treatment for it? No. And what we're trying to determine is, and we have some clinical trials that are starting. If everyone wants to look it up, if you Google NIH Recover, RECOVER study. And this is being done nationwide. So people in California, those of you who are in South Carolina, we have plenty of different sites. Some of the things that we're trying to determine is, what predisposes you to it? Are there treatments? Some treatments that we're starting to study include Paxlovid, which may sound familiar because that was used for treatment. So unfortunately, no. People who are having lung symptoms, we're sending them to lung doctors. People who are having other symptoms, you may have to send them to their other specialists.
Okay, thank you so much. And then there's another one. You mentioned this in your talk. Is there a need for a physician's order to get the RSV vaccine?
It completely depends on where you are. Okay, so I've had patients who said no, I got it at my primary care doctor's office. I didn't have any issue with it at all. And some, like my patient, I actually called in to give the order for the RSV vaccine. So it seems like, there's always kind of some challenges when things are first rolled out, but it's not always that you are required to have the order.
Okay, so they should probably call your pharmacy before you get there or when you go there the next time to check about whether or not you need an RSV order. I can appreciate it may not be for everybody, but as Dr. Wiley pointed out, if you need an RSV vaccine, you're going to be over the age of 60. You likely have some ongoing immunocompromised status. Maybe you're diabetic. Maybe you're taking medications that change your red blood cell counts. You're a chemo patient on leukemia. You're taking some other medications that suppress your immune system. Kind of basically all the same things that we want people to get for COVID, people at risk for getting COVID, usually older, 60 plus. That's an important feature. And I think a lot of people don't really like to address that. But
Agree. So ask your primary care doctor.
Okay. I think before we turn you over to let Dr. Wiley go, she presented a little earlier. If there are any more questions for Dr. Wiley, can you please put them in the Q&A?
Box.
Can you talk
And
a little bit about the timing of getting the booster versus some people haven't gotten any shots related to COVID? What does that look like?
Oh, awesome question. So timing. So the fresh new bivalent booster vaccine became available in September. So if you are someone who's never ever had any of them, like, should you start from a fresh? No, you can go ahead and get your first shot, the most updated one. So, and with respects to, can you get all three of them? I've had people say, hey, what if I want to get all three at one time? Can you? Yes. Okay. I got mine too, same day, one arm. That works for me. It may not work for everyone. You can also, spread them out. Um, Another key point too is, if you had a horrible severe case of COVID 2 weeks ago, it does not make any sense for you to go and get a COVID booster, because you just got the best, most natural booster, rising your antibodies from natural infection. So if I had a patient who said, in September, I just had COVID, it was horrible, I would tell them, wait 2 to 3 months when these fresh antibodies are starting to decline, and then allow yourself to boost.
Okay. So there's a question here now about monkeypox.
So monkeypox vaccines are recommended for persons who are considered at higher risk for contracting monkeypox. In monkeypox, you're probably hearing that it's a sexually transmitted disease. Monkeypox is a illness that you can obtain from very close physical contact, however that contact may be. And it is recommended for, men who have sex with men, okay? Sex workers, irrespective of whether you're male, female, or transgendered. So people who are at high risk of having really close, intimate contact with someone who is likely to have it. Will your primary care doctor have it? No. Okay. Could you probably get it from your health department or an infectious diseases clinic? Yes, but all of infectious diseases clinics do not have them kind of routinely in stock.
Does the public health department have the monkeypox vaccine?
They should, yes. And if they don't, they will be able to, tell you exactly where you can go to get it.
Okay, let's see. Mr. Hutchinson, I'd just love to have you on the call, because you tell all of us that we look nice and you like to see us. So that makes us all feel good, like we actually matter. Thank you, Mr. Hutchinson, for noticing, whether we're there or not. So Dr. Wiley, he says we're lovely and professional. So
Thank you, Mr. Russell.
that's Hutchinson, Mr. Hutchinson.
Thank you, Mr. Hutchinson. And I saw someone just said, hey, I popped on, is there an RSV vaccine? So the answer to that is yes, there is an RSV vaccine for persons 60 years or older with what we call comorbid conditions that are immunocompromising, lung disease, heart disease, etc. And talk to your primary care doctor about it.
Okay, I think that does it for us for Dr. Wiley. Thank you so much, Dr. Wiley, for giving us information and spending the time with us. And Emily Bush has put in the chat the numbers you need to get to the Hope Clinic to be a part of the bone marrow trial and also the long COVID trial. She put the information in the chat, so please look at that chat information. And shingles, I think she went over that as well. If you're 60 and above, you need to have the shingle shot.
Yes, and I think I saw a comment too. The chat's coming across really quickly for me. Like, hey, if I've had shingles before, can I still get the shingle shot? Yes, you can.
Miss Cornelia?
Okay, well, excellent presentation again. As they are every week, the recording of this session will be up by this time next week, so you can go back and review if you missed something. But in the interim, I just want to remind everyone to go over to our YouTube channel. There are over 200 videos. I know that's quite a bit, but we've been hosting this program for the last 2 years. And so we want to continue to encourage you to go to our YouTube channel. A lot of those frequently asked questions that you have are on that channel. Thank you for posting the link. You can take a few minutes to grab that link And then if you're in the Metro Atlanta area, Dr. Parker, are you still on? If not, we want to really call attention to our 25th Brain Health Forum. Hello. We're going to be at the Carter Center in 3 weeks. So please take note. We will not be on Brain Talk Live. We're going to be at the Carter Center. So Dr. Parker, I'm going to bring up that slide while you tell them what they can expect for our 25th Brain Health Forum.
Okay. All right. So in the next 3 weeks, it's actually 3 weeks. We're going to be at the Carter Center Library, keeping our fingers crossed for our 25th Brain Health Forum. It will begin at 10 a.m. and will be finished between 12:30 and 1, depending upon how long it takes you all to get through and get out. But our presenters are varied. We are going to have Dr. Todd Gold, who heads our Center for Neurodegenerative Disorders here at Emory, as one of our keynoters. We're going to invite back Dr. Elizabeth Marsh from Johns Hopkins University, who is a stroke neurologist who's going to talk to us about cognitive rehabilitation and restoration. We have Dr. Laura Gitlin, who's a nursing and caregiving research specialist from Drexel University, who's going to talk about dementing behaviors. Dr. Omar Samad from Eisai Pharmaceuticals, who's going to talk to us about the kinds of research that are done by the Eisai company, and like the newer drug that's available for Alzheimer's is one drug, but there are also other drugs that the pharmaceutical company has developed research for, and he's going to talk to us a little bit more about that. I think that we're pretty much up to date. Space is limited. We'll be serving some very brief refreshments. We won't be giving you lunch. We'll give you a gift card for lunch, but we will not be televising this live stream. It will also be one of those things that's available afterwards. I think somebody's trying to say something. There it is. Emily has put in the chat, our 25th Forum will be only at the Jimmy Carter Center. If you want to attend, you join us at the Eventbrite website. She's got all kinds of fingers up there. Very good teacher. Trying to make sure that we keep it all together. So at the Carter Center on Tuesday, October 24th, no Brain Talk Live, but only our program at the Carter Center. And we look forward to seeing all of you there.
Okay, that's all of our housekeeping. Next week, who do we have before I turn it over to Megan? And then we're going to close out with some physical activity.
Next week, we have with us Mrs. Sue Peshtian from the Aging Research Center, who's going to talk to us about Medicare and Medicaid coverage for Alzheimer's evaluations and treatment.
Okay, so tune in next week. We're here every Tuesday at 2 p.m. And be sure to share this information with a friend. All right, Megan, tell us what is going on with cognitive empowerment, the cognitive empowerment program. Gosh, is it Monday?
And thank you so much. It's so good to see everybody. We're coming on to invite everybody to join us for a webinar tomorrow from 2 to 3 o'clock with the Cognitive Empowerment Program here at Emory. We are a research study program that works specifically with people that have mild cognitive impairment or an early stage of memory loss before dementia or Alzheimer's, where we know that lifestyle interventions, like we hear about on this Brain Talk Live, are so impactful and can make big changes in the trajectory of our memory and memory loss. So with that, tomorrow we are sharing programming from all of our instructors here at the Cognitive Empowerment Program, and we'll be presenting an accessible Tai Chi class about how to return to center, how to deal with stress, and how to be a little bit physical in the process. And somebody just dropped a link to our website into the chat if you're interested in learning more about the Cognitive Empowerment Program. And I'm also going to share a link to register for our webinar tomorrow from 2 to 3 o'clock as well. If you register once, you'll get weekly reminders every single week. And so I'll just drop that into the chat. If you have some free time tomorrow, we'd love to have you join our community with those who are also experiencing mild cognitive impairment as well. So thank you all so much. Thank you to Dr. Parker and Cornelia, and we hope to see you all tomorrow. I'll put those links into the chat for everybody right now.